Welcome back to Diabetic Foot Files, where we break down science behind healing, limb salvage, and the biology that keeps your skin alive and keeps your skin repairing. Today, we're going to talk about or dive into a nutrient that people don't really put much emphasis on or talk about, but yet every single cell in your body depends on it. And that is pantothenic acid, also known as vitamin B5, not B12. This is vitamin B5 we're going to talk about. So, this isn't just a vitamin episode. This is about energy at the cellular level because wound healing isn't magic, it's also about metabolism. So, your fibroblasts, your keratinocytes, your immune cells, they all need fuel. We all need fuel. And pantothenic acid is a key ingredient in building coenzyme A. What is coenzyme A? That is the molecule that allows your cells to turn food into usable energy. So without it, your cells can't run their engines. So when the cells can't produce energy efficiently, tissue repair slows down, inflammation lingers, and healing stalls. So we're going to talk about how this vitamin also was discovered, how it works in your body, why it matters to skin and wound repair, what happens when the levels are low, and the role of topical forms like dexpanthenol, and how this nutrient fits into the bigger picture of tissue regeneration. Because sometimes the difference between a wound that heals and one that doesn't comes down to nutrition. Remember, we talked about how important nutrition is, and we're going to talk about how this affects wound healing and cellular repair at the molecular level. So let's get into it. So pan so pantothenic acid. So what exactly is it? So it's vitamin B5. It gets its name from the Greek word pantothen. And what does pantothen mean? The Greek word, it means from everywhere, which is kind of ironic. So researchers choose that name because they found this vitamin in nearly all plants and animal tissue. And in 1930s, scientists were studying growth factors needed for yeast and animal development. And one of the key researchers, Roger J. Williams, isolated pantothenic acid while investigating essential nutrients required for life. Later research revealed it as part of a bigger biochemical system, not just a vitamin, but also a building block of one of the most important molecules in human metabolism. So, scientists discovered pantothenic acid is required for coenzyme A, CoA. So this changed everything because coenzyme A is central to energy production, fat metabolism, protein metabolism, carbohydrate metabolism, and without pantothenic acid, coenzyme A cannot form. So the cells cannot run properly. So how does pantothenic acid work in the body? So after ingestion, pantothenic acid is absorbed in the small intestines and it is converted into coenzyme A. And coenzyme A acts like a molecular carrier that transports the carbon fragments in the metabolism. So it participates in the process of the Krebs cycle. And why does that matter? Because the ATP production, everybody knows that. And I know a lot of people hate the Krebs cycle. Some people do, some people don't. Chemistry people, they love it. So I'm not going to hate. It's up to you. The fatty acid synthesis, which why that matters, is skin barrier and cell membranes. The fatty acid breakdown that matters because the energy, cholesterol, and steroid synthesis plays a role in hormone imbalance. And then acetylcholine production, which helps with nerve signaling. So why does this matter when it comes to healing? So we all know wound repair demands rapid cell division, collagen formation, lipid synthesis, and energy. And pantothenic acid supports all of these by fueling the cellular metabolism. So deficiency, B5 deficiency, is actually quite rare. But How does it present if it happens? Burning in your feet syndrome, fatigue, neuropathy, impaired healing. Because the tissues have high turnover rate, the skin and nerves are hit first because they need the energy. So, hopefully, we understand now that pantothenic acid isn't just a vitamin, it's the gateway to coenzyme A. And this molecule runs the nutrients into energy and rebuilds the tissue. Okay. So if you don't have no B5, that means no coenzyme A, and no coenzyme A means no energy, and no energy means poor healing. So when this role in skin health. So pantothenic acid helps maintain epidural, I said epidural, epidermal, okay? Dermal barrier lipids, sebum production, skin hydration, and deficiency may also look like dry, fragile skin. So, what are the sources of getting B5 vitamin? It's found in the meat, the eggs, the whole grains, the avocados, the legumbres, and like I said, that's why they got the name. It's found in many foods. It's found everywhere. So, what does research show? Research shows that B5 supports epithelial regeneration. There, remember, I also said there's a topical form called dexpanthenol, and that improves the skin barrier recovery. And like I said, it also enhances hydration and reduces inflammation. It also supports fibroblast and keratinocyte function. So let's do a quick recap. So, pantothenic acid, like we said, that's the precursor of coenzyme A, which is required for because coenzyme A is required for cellular energy, aka ATP production, right? Fatty acid metabolism, collagen synthesis, keratinocyte proliferation, and skin barrier repair. So it's a metabolic support vitamin. So it's not like a direct antimicrobial or growth factor. It's nothing like that. So, like I said, the deficiency of this is very rare because you can pretty much find it in any plant in a lot of different foods. But general intake, like they usually do 5 milligrams. And like I said, this is not medical advice, this is for medical education. Okay. So, it is water soluble. So, high doses of this vitamin B5 will cause diarrhea. So, you don't want that. I mean, I just get an over the counter B vitamin complex to make sure it has B5 because, yeah. Okay, so now the topical form, dexpanthenol. So the topical version of this, it's a provitamin B5. So the common concentrations of this is 2 to 5% creams and ointments. Okay, that's the percentage of it. Okay, sometimes found in barrier creams or post-procedure skin products. And just again on the side note, do not like self-dose or self-medicate or anything like that. Okay, not for this. Not This is not for that. If you ever wanna even I even tell patients if you wanna try a new vitamin or something like that, you should speak to your internal medicine doctor before, because you don't know if you'll react badly to it. You don't know if the medication that you're currently on will have side effects or make the medication that you're supposed to have work inefficiently, things like that. So make sure you consult your actual physician before trying to switch or add a new vitamin to it. But sometimes people can also get like a flush from B vitamins. So yeah. So what does this topical form does? That's panthenol. It improves skin hydration. It supports epithelial regeneration. It enhances barrier repair. It reduces transepidermal water loss, and it has mild anti-inflammatory effects. So that's good. So they usually use stuff like this, like for radiation dermatitis support, minor wounds, dry, irritated skin, post procedure healing. So, how does B5 pantothenic acid help support wounds? So, with the fibroblasts, it helps affect the collagen production. With the keratinocytes, it helps with proliferation. With the endothelial cells, it indirectly helps the metabolic support of that cell. And then skin barrier, it helps with lipid synthesis. So it works by fueling metabolism, not by killing bacteria. So, what are some of the limitations of this vitamin? Not a substitute for offloading or any infection control, does not fix ischemia. It's just a adjunct. Okay. And like I said, you should have a nutritionist, especially if you have diabetes or even any type of wound, should have a nutritionist. See if there's any deficiencies anywhere that we can fill the gaps to help you be nutritionally optimized for better wound healing outcomes. So let's do some quick recall questions when it comes to this. So, what is pantothenic acid converted into? Like, what's the critical molecule? Coenzyme A. What is pantothenic acid, also known as B5? What is the topical form of B5 that is used in dermatological preparations? Dexpanthenol. What primarily supports the wound cell? What does B5 primarily support? Which wound cell? The fibroblast. Which macromolecule production in skin relies on B5? The fatty acids. And next one, last one, pantothenic. Pantothenic acid supports which phase of the wound healing mode? The proliferative phase. So this is Diabetic Food Files. I hope everybody enjoyed it. I had to do this super quick, but I'm just trying to keep my word. And this is Dr. G. And take care of your feet because they take care of you.